So this is the second presentation in this session, which is about the PrEP appeal study, but this is the other side of the study that Nita didn't talk about, which is the Asian side. We did this survey in 15 different Asian countries. So I'll be talking not so much about PrEP in this presentation, but a way of looking at the behavioural risk data that we collected in a survey. There are my disclosures. So obviously we know that Asia is home to some of the fastest growing epidemics among men who have sex with men globally, particularly in the Philippines, but also a few other countries. It's important to understand the risk practices of key populations so we can understand how to address these epidemics. And while behaviour is becoming a little bit less of a focus of research in recent years as we focus more on things like PrEP and other biomedical prevention, it is important to monitor behaviour and also to understand how behaviours change at the community level with the introduction of things like PrEP and U=U. So in MSM, over the years, the traditional behavioural measure of risk was any condomless intercourse in the last, say, 6 or 12 months. What we actually use in Australia is slightly more focused, which was any condomless intercourse with casual partners, because in our setting, what we've been able to show over many studies is that regular partner contacts are less risky than casual partner contacts. That's not true everywhere, so for some places it is actually appropriate to just talk about any condomless intercourse. And this approach has been really shown to be quite useful in ecological research, which has shown that you can, when you compare the rates of condomless intercourse reported by gay and bisexual men with casual partners, they can be quite highly correlated with HIV diagnoses. And here's a bit of an older slide of some of these data, where all the coloured lines there are different behavioural surveys asking the proportion who have condomless sex, and then in the red dotted line, it's the diagnosis curve for Australia. So you can see there's about a 2-year delay between changes in behaviour and what happens with diagnoses. But the science and implementation of PrEP and U=U means that there are new forms of condomless intercourse that are now safe from HIV transmission, and these need to be incorporated. So we needed a new indicator of behavioural risk that did include PrEP and U=U into this understanding of risk. So we came up with a measure that we call prevention coverage. And what we do here is classify all men who report casual sex into one of these mutually exclusive categories. The group that have no intercourse in the last 6 months, the group that consistently use condoms, those people living with HIV who have condomless sex and who are on ART or virally suppressed, those who are negative and who are on PrEP who report condomless sex, and then those who are having condomless sex, who are people living with HIV who are not on ART or have detectable viral load, and then the flip side, those negative men or untested men who are not on PrEP who report condomless sex. And so then you can divide these into what we consider the safe categories, and then in the red, they're the higher risk categories. So when we first invented this different measure of risk, we didn't know what was going to happen when PrEP was introduced into Australia. And here are 2 scenarios that were kind of posed at the time. The yellow on these graphs is the PrEP use. So was PrEP going to actually decrease the red, which is the higher risk group? Or perhaps was it just going to decrease condoms, but keep the red the same? What actually happened in Australia was a little bit of both. So the green, the consistent condom use category definitely went down, but so did the high risk category of those in red, and you can see how PrEP really started to swallow it. If you go beyond 2020, we're actually in a position in Australia now where PrEP is the most common form of HIV prevention used. So this indicator was actually the basis for the HIV prevention coverage target that's in the UNAIDS global strategy. UNAIDS saw this work and they actually borrowed it and then created this target of 95% of people at risk of HIV using one or another form of combination prevention. And the way that we monitor this target in Australia is using our behavioural surveillance systems. So in this presentation, what we were thinking was, could we apply a similar approach? Of course, it's only cross-sectional, not over time, to the Asian situation. Nita has already mentioned the PrEP appeal study, which was really about preferences for PrEP. But this analysis is looking at the MSM in these 15 Asian countries and territories, the overall prevention coverage, and then factors associated with that higher risk category of sex. So as Nita said, this is an online cross-sectional survey. It was conducted in 15 Asian countries and territories in MSM and trans women, but this analysis only focuses on MSM. It was conducted in 2022, and recruitment was done by online advertising, community organisations, and also influencers. So In this study, we only included negative and untested men, so we had to adapt our prevention coverage target a little bit. So we had to take out the ones that were relevant for PL-HIV, but the rest of them are essentially the same. So the higher risk category, I just want to point out there, I'm calling throughout all the slides, it's like click no PrEP, so condomless intercourse with casual partners, click with no PrEP is what I'm considering the higher risk category here. So we restricted this to sexually active men. We grouped countries in terms of lower to middle income countries and high income countries, and then I'll just go through the analysis as I move through. So 17,000 people were recruited and completed the survey, and this analysis includes the 13,500 MSM who were sexually active. Here's the breakdown of the numbers by country. So you can see there was several countries where we had over 1,000 participants, and then some smaller countries there. Fairly young sample with a median age of 30, most identified as gay, but you can see there was a high proportion of bisexual participants in the lower to middle income countries. About 2/3 lived in a capital or large city, were university educated and were employed or working full time. In terms of testing, this is a quite highly tested sample, so over 2/3 were tested in the last 12 months. So I think that says something about a bit of selection bias here. I don't think you'd find that level of testing in a general population sample. And in terms of PrEP, about just nearly 20% were not aware of PrEP, over 50% had never used PrEP, 8% were former PrEP users, and then about 20% were current PrEP users. This is the sort of headline results here about that 4-category risk indicator. So about 44% were in that highest risk category of click with no PrEP. You can see about 11% with no anal or vaginal sex in the last 6 months, 30% were consistently using condoms, and then 15% were using PrEP. And then you can see the slight differences there between lower, middle, and high income countries. When you look at coverage, what this means is about 56% were considered to be covered. A lot of diversity by different countries, and I think some of this diversity is sort of what you might consider real, that there are real differences between the countries, and some of this diversity is probably because of selection bias. So for example, you can see Nepal there with that really gigantic level of yellow, which is PrEP use. That probably doesn't represent the level of PrEP use in overall among MSM in Nepal. But for Vietnam, where we know the PrEP program is quite large, that 37% may actually be a little bit more accurate. You can see there just the diversity across the countries in terms of prevention coverage as well. In terms of factors associated with this high risk category of click with no PrEP, if it was more positively associated with being in a high income country, for those who had been paid for sex, so sex workers, which could be either like sex work as a profession or sex work for gifts and favours. It was higher in chemsex people, a little bit lower in according to age, people in a relationship, and those who inject drugs. And interestingly, people in the high risk category were more likely to prefer on-demand PrEP or to prefer a monthly oral pill over daily oral PrEP. So there are some limitations to this very basic analysis I'm presenting today. It's not necessarily representative of all MSM in these countries, obviously. Participants had to have access to the internet to participate. The community-based recruitment could have oversampled men who are connected to the community, so that probably leads to an overestimate in PrEP use in some settings. And of course, the bias is associated with self-report. And the method of calculating risk here, it may overestimate higher risk. We have to acknowledge that you could get into that higher risk category if you just had one episode of condomless sex in the past 6 months that was not covered by PrEP, right? So being in that category doesn't mean that you're necessarily at frequent risk, it's just that you're at some risk. We can actually break it down a little bit more by frequency, but it starts to get into very small numbers. So just to conclude, we did find that significant proportions of MSM through Asia reported sexual behaviour with a risk of transmission. And overall, this was nearly half of participants at 44%. Keeping in mind that in Australia, our prevention coverage was up to 82%. So you can see how different that is in these different settings. In 4 countries and territories, more than 50% of the MSM were in this high risk category. And we saw that high risk in those engaging with sex work and chemsex. So the prevention coverage that we saw overall at 56% was well below the target outlined in the UN AIDS strategy, which is 95% by 2030. And greater PrEP access, including access to new PrEP modalities, and supporting condom use need to remain priorities in this region. And obviously those two can sometimes feel a bit at odds at each other. So we need to find ways to make sure that people who feel comfortable using condoms can continue to do that, while also ensuring that people have access to PrEP and understand U equals U. And I guess the final conclusion would be that hopefully this new way of thinking about risk could be useful in the Asia-Pacific setting. So I'd just like to thank all the other investigators that were not named on this particular paper, all the participants, of course, our funders, and all our contributors. And you can see all the contributors in the report that's at that link on the page there. Thanks very much.
Yeah.